Jobs for home health aides are expected to grow by 17% over the next few years, which is big, some of the biggest growth for any occupation. However, the pay is pretty low, just on average $35,000 a year, according to federal statistics. That could increase as baby boomers get older and more people want to age at home, and there's more demand for home health aides. It's a people job, and it's not easy when patients are not used to asking for help. What a day of a North Country home health aide is actually like on today's Story of the Day.
Support for Story of the Day comes from Clarkson University, offering over 95 programs of study with campuses in the Hudson Valley, Central, and Northern New York. More at clarkson.edu.
Hey, I'm David Sommerstein. It's Friday, December 5th. First up. Yesterday, the North Star Health Alliance announced its facilities, including Claxton Hepburn Medical Center in Ogdensburg and Carthage Area Hospital, might not be able to make payroll next week, and that closure could be imminent. Republican lawmakers, including Congresswoman Elise Stefanik, who's running for governor, threw a barrage of blame at Governor Kathy Hochul. But after a hailstorm of meetings yesterday and today, Republican Assemblyman Scott Gray of Watertown says he's hopeful this issue is headed toward resolution. Amy Feiereisel reports.
Gray says he's spoken with representatives from the Department of Health, Division of Budget, and the governor's office, and that he's heartened that everyone seems to be on the same page.
All conversations have been amicable, and we're all focused on the same thing. We're making sure people will receive their paychecks and making sure we will provide services on an ongoing basis.
At the heart of the current financial issue is the transformation of the Claxton Hepburn Hospital in Ogdensburg into two new entities, a critical access hospital and a behavioral health hospital. That move has been in the works for over 3 years, with a state commitment to see the facility through the change. But Gray says it required a period that would be tricky billing-wise.
So we knew that there was going to be some difficulty through this transformation. And, the state was there and made the commitment to gap fund some of this transformation. There's been a lot of money that's gone into this facility, although it's not entirely what they were expecting at this point, and that's where the difference is right now.
This is where it gets sticky. The state says the North Star Health Alliance hasn't provided some of the basic information it needs, including how certain funds are being used and facility financial records. North Star Health Alliance officials have said in statements that they've answered all these questions. They didn't directly respond to NCPR's request for comment before deadline for this story. Gray says this gap of what's being asked for and what's being given is the real problem.
So we want to make sure that we're all on the same page, and the state is doing their due diligence but not being onerous, and the facility is being cooperative.
Gray says he's feeling optimistic after meaningful conversations and that critically, state agencies are responding after a recent void in communication. Amy Feiereisel, North Country Public Radio.
The Adirondack Land Trust has released a new survey that maps out accessible trails across the Adirondack Park. As David Escobar reports, the study is part of a broader push to open more outdoor recreation opportunities in the park to people with mobility issues.
The Land Trust study looked at 36 trails across 7 Adirondack counties to evaluate the accessibility of trail conditions, things like slope, width, and surface stability. Researchers also checked whether trailheads had accessible parking spaces and toilets for visitors. Of the 36 trails surveyed, 21 meet accessibility guidelines. Most of the trails are short hikes, but some, like John Dillon Park, the Warren County Bikeway, and the Adirondack Rail Trail, stretch for miles. Accessible Adirondack Tourism Executive Director Nick Friedman consulted on the survey. He says having detailed accessibility information is helpful for anyone who might feel unsure about trying a new trail.
The more that people know about what they will encounter on a trail, the more they can easily plan their get-together, can plan their outing, and therefore the more satisfactory experience they'll have, and then they'll come back.
The survey also rated each trail's wildland feel, a measure of how natural and remote a place seems based on things like road noise or nearby development. 9 of the accessible trails earned medium to high scores. Beyond the Land Trust survey, the state is expanding its own outdoor accessibility tools. Last year, the DEC launched an interactive map highlighting accessible recreation spots across the state. Friedman says making Adirondack trails more accessible ultimately promotes conservation.
This exponentially increases the number of people with disabilities that visit our trail system. The more people that can visit, the more people that can understand why protecting the Adirondacks is so important.
A full list of accessible trail sites and an interactive map can be found on the Adirondack Land Trust website. David Escobar, North Country Public Radio.
The North Country's population is aging, and as people get old, the majority want to age in place, stay out of a nursing home. It sent the demand for home health aides soaring across New York State and throughout the United States. So in today's North Country at Work story, what's it like to be one? Anna Williams-Bergen has more.
There are few jobs that bring you into people's lives as intimately as being a home health aide. Diane Rogers has been one for about 25 years. She's cared for people across 4 North Country counties, and she says it can be a bit of a power struggle.
We're in their home, so it's their rules, whether we agree with them or not.
Rogers describes her job as doing everything you would do in a day, just for someone else. She cooks, cleans, and grocery shops, helps patients shower or get some movement in. Whether they want to cooperate is a different story. A lot of the job is just convincing people to shower or eat. Rogers says she knows how to make people think they're operating on their own schedule, not hers. It's for their own good.
And I had one lady, it's like, it took me hours to get her in the shower. And then once she got in and got all lotioned up, I feel so much better. I said, see, I told you.
Rogers says it can be a bumpy road at first. It's hard for people to accept help and to change their routines.
Somebody's coming in your home and you've done the same thing and eaten the same thing for years. And they're like, well, maybe you should try some kale or something like that. No.
Having a home health aide cook your meals and help you bathe represents a loss of independence that can be tough for many.
And they never thought that they would want a home health aide. But it was either that or the nursing home, and they definitely don't want that.
Rogers does the same tasks day in, day out with 3 or 4 different patients. And she's been doing this work for over 2 decades. But she says there's comfort in the routine.
Sometimes it feels repetitive, but sometimes that's a good thing. Because sometimes you don't want, the issues that come up during the day. Call the nurses and, report that they don't feel good. Nobody likes doing that.
Rogers isn't just helping around the house. She also acts as a lookout for each patient's care team, helping keep nurses updated on how they're doing.
We can see the changes because we don't live there with them. So, if we go in one week and they look good, and then the next week, what's going on? Because we can tell because we don't live with them. So that's, we're at the eyes and ears.
The reality is that the folks she takes care of get older, sicker. Sometimes they die. And it can be hard on Rogers because the nature of caregiving brings her intimately close with patients. For some of them, she's the only person they talk to in a given day. When there's time, Rogers and her patients play cards. She'll read to them. Rogers says she gets to know a lot about people's lives.
We become family, which makes it hard, but because when you first take in, they say, don't get attached. Well, if you've had the same people for 10 or 12 years, how do you not get attached?
It's hard, but Rogers became a home health aide because she liked helping people. So it's just what she does. For North Country Public Radio's North Country at Work project, I'm Anna Williams-Bergen in Chattagay.
North Country at Work is a long-running project of NCPR that collects photos and stories about working life in our region. If you have a work story you'd like to share, email us work@ncpr.org. We have more news through the weekend on our website, ncpr.org. Music today by Tim Ullifritz of Johnsburg and Wyatt LaMarche of Canton. Have a great weekend. I'm David Sommerstein, North Country Public Radio.